Welcome to this online presentation on the health insurance marketplace. This session was developed and approved by the Centers for Medicare and Medicaid Services, the federal agency that administers Medicare, Medicaid, the Children's Health Insurance Program, and the health insurance marketplace. This presentation is designed to give you the information you'll need to have a common understanding of the new coverage opportunities that will be available this fall. Whether you're uninsured or just want to explore new options, the marketplace will give you more choice and control over your health insurance options. For additional information about the marketplace, you can refer to the official program legal guidance contained in the relevant statutes, regulations, and rulings. The session topics we'll cover include an overview of how the marketplace works, what it means for individual consumers and small employers, who is eligible to enroll, and how programs for people with limited incomes work, including new tax credits or advance payment of premium credits and cost-sharing reductions. We'll also talk about how the healthcare law has affected Medicaid and the Children's Health Insurance Program, and the types of personalized assistance that will be available. Lastly, we'll share some key points to keep in mind and where you can go for more information on the marketplace. So, let's get started. When key parts of the healthcare law take effect in 2014, there will be a new way to get health insurance, the health insurance marketplace. The marketplace is designed to help you find insurance that fits your budget. The marketplace will pool buying power and give Americans new, affordable choices of private insurance plans that have to compete for their business based on cost and quality. Small business owners will not only be able to choose insurance coverage through the marketplace, but will receive a new tax credit to help offset the cost of covering their employees. Every health insurance plan in the new marketplace will offer comprehensive coverage from doctors to medications to hospital visits. You can compare all your insurance options in plain language that makes sense. When you shop at the marketplace, all your costs are stated up front, so you'll get a clear picture of what you're paying and what you're getting before you make a choice. Under the healthcare law, there will also be new protections for you and your family. Health insurance companies can't refuse to cover you or charge you more just because you have a chronic or pre-existing condition, and they can't charge more for women than for men. Thanks to new rules and expanded programs, even working families will be able to get help through the health insurance marketplace. There will be new expanded programs available, and more people than ever before will qualify for free or low-cost health insurance programs. Most people will be able to get a break on cost through the marketplace, even if they think their income is too high to get help. One application, one time, and they'll see all the programs they qualify for. The health insurance marketplace, also known as exchanges, is where individuals and small employers will go to compare and purchase competitive private health insurance plans, known as qualified health plans or QHPs, on the basis of price, quality, and other factors. Enrollment starts October 1st, 2013, and the marketplace will be fully operational by January 1st, 2014. The marketplace will help enhance competition in the health insurance market, improve choice of affordable health insurance, and give small businesses similar options as large businesses. The marketplace is designed to help you find health insurance that fits your budget. Eligible individuals and small businesses can shop for affordable private coverage from qualified health plans. Qualified health plans in the new marketplace will be sold and run by private companies. Every qualified health plan will cover a core set of benefits called essential health benefits. You'll be able to compare your options based on price, benefits, quality, and other important features. This allows you to have an apples-to-apples comparison. When you shop at the marketplace, information about prices and benefits is written in simple terms you can understand, so you don't have to guess about your costs. You get a clear picture of what you're paying and what you're getting before you make a choice. New and expanded programs will be directly linked in, and more people than ever before will get a break on costs. You'll have guaranteed coverage and renewability regardless of sex, age, or a pre-existing condition like cancer or diabetes. Let's talk about how the marketplace will work. The marketplace will make it easier to find insurance coverage that fits your needs. To increase affordability, you'll be able to find out if you're eligible for advance payment of the premium tax credits, cost sharing reductions, or public insurance programs to make coverage more affordable. The marketplace will also offer personalized help through a number of resources. A website, a call center, and community groups or individuals specifically designated as navigators will help consumers with coverage options and questions. Depending on the state, insurance agents and brokers may also be able to help consumers and small employers find coverage options in the marketplace if they meet criteria we'll discuss later. The marketplace will ensure that all qualified health plans in the marketplace meet basic standards, including quality standards, consumer protections, and access to an adequate range of doctors and clinicians. Through the marketplace, there will be one process to determine if you can enroll in a qualified health plan. If you're eligible for the new tax credits, which you can use right away to lower what you pay for your monthly health plan premium, or if you're eligible for cost-sharing reductions or other health insurance programs like Medicaid, a federal-state program which covers certain people with low income and resources, and the Children's Health Insurance Program, which covers certain children. You can enroll promptly and easily in the appropriate program. One marketplace application, one time, and you'll see all the programs you qualify for. The marketplace offers competition, choice, and clout. Insurance companies will compete for business on a level and transparent playing field. In order for the marketplace to operate, it must follow some basic rules. It must offer only qualified health plans that meet minimum standards. Plans must ensure high quality and offer a choice of plans that cover essential benefits like emergency services, hospitalization, prescription drugs, preventive and wellness services, and maternity and newborn care. They must provide information on the monthly premiums, deductibles, and out-of-pocket costs before you decide to enroll so you can make an apples-to-apples comparison, making the best choice to meet your needs. The marketplace can only offer qualified health plans, including standalone dental qualified health plans that cover pediatric dental benefits. A qualified health plan means the plan is offered by a health insurance issuer that is licensed and in good standing and has met the criteria for certification issued or recognized by each marketplace where the plan is offered. It must also provide the essential health benefits package, which we'll cover next, and offer at least one plan in the silver level and one in the gold level. We'll talk about plan metal tiers later. The issuer must agree to charge the same premium rate for each qualified health plan, whether the plan is offered through a marketplace or offered directly from the issuer or through an agent. The plan must also comply with the regulations developed by the Secretary and other requirements as an applicable marketplace may establish. As we said, each qualified health plan must cover essential health benefits. The healthcare law directs that this package of benefits be equal in scope to the benefits covered by a typical employer plan and cover at least the following 10 general categories: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services and chronic disease management, and pediatric services, including oral and vision care. The healthcare law requires that plans meet certain levels of coverage called metal tiers. There's a bronze, silver, gold, and platinum level. Each of these levels of coverage is associated with an actuarial value, which is based on the provision of the essential health benefits to a standard population, and without regard to the population the plan may actually provide benefits to. The actuarial value is a measure of the percentage of expected healthcare cost a health plan will cover and can be considered a general summary measure of a health plan's generosity. For example, if a plan has an actuarial value of 70%, on average, you would be responsible for 30% of the cost of all covered benefits. However, you could be responsible for a higher or lower percentage of the total cost of coverage services for the year, depending on your actual health care needs and the terms of your insurance policy. While premiums are not taken into account to calculate the actuarial value, generally, plans with a higher actuarial value and more generous cost sharing tend to have higher premiums. So, as we illustrate on this slide, a bronze level plan will have an actuarial value of 60%. This means, on average, a consumer would be responsible for 40% of the cost of all covered benefits. A silver level plan will have an actuarial value of 70%, leaving a consumer on average responsible for 30% of the cost of all covered benefits. The silver level plan is used for figuring the cost sharing reductions and premium tax credits for eligible individuals. A gold level plan will have an actuarial value of 80%, again, with a consumer on average responsible for 20% of the cost of all covered benefits. And lastly, a platinum level plan will have an actuarial value of 90%, with a consumer responsible on average for 10% of the cost of all covered benefits. The benefits covered remain the same regardless of the metal tier. The only difference is in the costs. Generally, a bronze level plan will have the lowest monthly premium and highest out-of-pocket costs, and a platinum level plan will have the highest monthly premium and the lowest out-of-pocket costs. So now that we've shared a little about how the marketplace works, let's talk briefly about the Small Business Health Options Program, which is known as SHOP. SHOP is a marketplace for small businesses and their employees. Today, small employers have a tough time finding and affording coverage that meets the needs of their employees. Starting in 2014, they'll have more choice and control over health insurance spending through SHOP. Employers can choose the level of coverage they offer and define how much they'll contribute toward their employees' coverage. They'll also have exclusive access to an expanded small business healthcare tax credit. This tax credit covers as much as 50% of the employer contribution toward premium costs for eligible employers who have low to moderate wage workers. When they buy insurance through the SHOP, it makes it easy to take advantage of other tax breaks too, including the chance for the small business and its employees to use pre-tax dollars to make premium payments. Small businesses and their employees will also benefit from the new protections that help them get real value for their premium dollars. There are new limits on the higher premiums insurers can charge businesses with older employees, and an employee with high health care costs no longer increases the small business's group premium. There are also new limits on the share of premiums going to insurers' profits and administrative costs. There are requirements a small employer must meet in order to participate in SHOP. Small employers must have fewer than 100 employees to be eligible to participate. However, states may define a small employer eligible to participate in SHOP as one with 50 or fewer employees until 2016. An employer must meet certain eligibility requirements to be eligible to purchase coverage through a SHOP, which includes they must be a small employer, they must elect to offer at a minimum coverage in a qualified health plan to all full-time employees through a SHOP, and 3, the small business must either have its principal business address in the marketplace service area, offering coverage to all its full-time employees through that SHOP, or offer coverage to each eligible employee through the SHOP serving that employee's primary worksite. Those in business as sole proprietors are considered individuals and may buy through the marketplace but not through a SHOP. Now, let's talk about how marketplaces will be established. A state has substantial flexibility in establishing a marketplace that meets the needs of its citizens. States across the country have received grants to establish new marketplaces and may create and operate their own marketplace. Or states can choose to participate in a hybrid called a partnership, in which the state runs certain activities for the marketplace operated by the federal government. A partnership marketplace allows states to make recommendations for key decisions and help tailor their marketplace to local needs and market conditions. The federal government will establish and operate a marketplace in those states that do not establish their own. A state can operate a marketplace as a nonprofit entity established by the state. It can also choose to operate it as an independent public agency or as part of an existing state agency like their state Medicaid agency or Department of Insurance. Marketplaces that are run by independent agencies or nonprofits must have governance principles, include consumer representation, ensure freedom from conflicts of interest, and promote ethical and financial disclosure standards. If a state chooses not to create and run their own marketplace, the marketplace will be established by the federal government. The state can work with the Department of Health and Human Services, or HHS, to perform activities of plan management and/or consumer assistance, education, and outreach. States may apply at any time to run their own marketplace in future years. A state electing to seek approval of its marketplace later than January 1, 2013, must have an approved or conditionally approved marketplace blueprint and operational readiness assessment at least 12 months prior to the marketplace's first effective date of coverage. They must also develop a plan jointly with HHS to facilitate the transition to a state marketplace. There will be federal support for initial costs. The cost to states for establishing a marketplace and testing marketplace operations during 2014 may be funded by federal grants. Additionally, these grants may be awarded before January 1, 2015, for approved establishment activities that fund first-year startup activities. A state may also receive grants for activities to establish and test functions that the state performs in support of a marketplace established by the federal government, including for a state partnership marketplace. Generally, states will not be required to repay funds, provided funds are used for activities approved in the grant and cooperative agreement awards. By law, states operating a marketplace in 2014 must ensure that their marketplaces are financially self-sustaining by January 1, 2015. No grants will be awarded for operational costs after January 1, 2015. Navigators may not be paid through these grants, but through operational funds.
We've gone over a lot of information about the marketplace. Let's test your knowledge to be sure you remember some key points. Which of these must a plan do to be a qualified health plan in a marketplace? A. Cover essential health benefits. B. Be offered by an issuer that is licensed by the state and in good standing. C. Agree to offer at least one plan in the silver level and one in the gold level. Or D. All of the above. The answer is D. All of the above. Among the requirements to be a qualified health plan, a plan must cover essential health benefits, it must be offered by an issuer that is licensed by the state and in good standing, and it must agree to offer at least one plan in the silver level and one in the gold level. Here is the second question. Which of these are the four metal tiers or levels of coverage in a qualified health plan? A. Silver, gold, titanium, and platinum. B. Bronze, silver, gold, titanium. C. Bronze, silver, gold, platinum. Or D. Tin, silver, gold, platinum. The answer is C. The metal tiers or levels of coverage include bronze, silver, gold, and platinum.
Now we'll talk about who is eligible to enroll in the marketplace and how to purchase health insurance through the marketplace. To be determined eligible for enrollment in a qualified health plan through the marketplace, you must meet the applicable residence standard. This means you must live in the state served by the marketplace or the service area of the marketplace. You must also be a citizen or national of the United States, or a non-citizen who is lawfully present in the U.S. and is reasonably expected to be a citizen, national, or non-citizen who is lawfully present for the entire period for which enrollment is sought. You cannot be incarcerated other than incarceration pending disposition of charges. If you meet all of these eligibility requirements, you are considered a qualified individual. There are specific time periods that a qualified individual can enroll in a qualified health plan or change plan. The initial open enrollment period begins October 1st, 2013, and extends through March 31st, 2014. This slide helps illustrate how, when you enroll in the marketplace, affects when your coverage begins. If the marketplace receives a qualified health plan, QHP, selection from a qualified individual from October 1 to December 15, 2013, the marketplace must ensure an effective date of coverage of January 1, 2014. If the selection is received between the 1st and 15th day of any subsequent month during the initial open enrollment period, the marketplace must ensure an effective date of coverage of the first day of the following month. If the selection is received between the 16th and last day of the month for any month between December 2013 and March 31st, 2014, the marketplace must ensure an effective date of coverage of the first day of the second following month. The marketplace has an option to allow for earlier effective dates, but subject to demonstrating to HHS that all of its participating QHP issuers agreed to make coverage effective in a time frame shorter than what we've illustrated. The marketplace may do one or both of the following for all applicable individuals. For a qualified health plan selection received from a qualified individual, the marketplace may provide an earlier effective date provided that either A, the qualified individual has not been determined eligible for advance payment of the new tax credit or cost-sharing reductions, or B, the qualified individual pays the entire premium for the first partial month of coverage as well as all cost sharing. For a qualified health plan selection received by the marketplace from a qualified individual on the date set by the marketplace after the 15th of the month for any month between December 2013 and March 31, 2014, the marketplace may provide an effective date of coverage of the first of the following month. Later, we will talk about Medicaid and the Children's Health Insurance programs. It is important to note that, unlike the marketplace, you can apply at any time for these programs. There is a special enrollment period, or SEP, in certain situations. This slide outlines the certain qualifying events that may take place that allow you to enroll at a time other than what we've already discussed. A special enrollment period lasts 60 days from the date of the qualifying event in an individual market and 30 days in a small group market. So, you could have an SEP if you are a qualified individual in one of the following situations. If you or your dependent loses minimum essential coverage, and by that we mean loss of coverage from certain government-sponsored programs like Medicare, Medicaid, VA, or etc., an employer-sponsored plan, plans in the individual market, grandfathered health plans, which are certain plans that were in existence prior to Marketplace, or other coverage, such as state health benefit risk pools, you qualify for an SEP. I want to point out this loss of coverage does not include termination or loss of coverage because you didn't pay your premiums on a timely basis, including COBRA premiums prior to expiration of COBRA coverage, or an act, practice, or omission that constitutes fraud. You could qualify for an SEP if you gain a dependent or become a dependent through marriage, birth, adoption, or placement for adoption. If you weren't previously a citizen, national, or lawfully present, and you gain such status, you could qualify for an SEP. If your enrollment or non-enrollment in a qualified health plan is unintentional, inadvertent, or erroneous, and is the result of an error, misrepresentation, or inaction of an officer, employee, or agent of the marketplace or HHS, or its instrumentalities as evaluated and determined by the marketplace, you qualify for an SEP. In such cases, the marketplace may take such action as may be necessary to correct or eliminate the effects of such error, misrepresentation, or inaction. If you adequately demonstrate to the marketplace that the qualified health plan you are enrolled in substantially violated a material provision of its contract in relation to the enrollee, or if you are determined newly eligible or newly ineligible for a new tax credit, or have a change in eligibility for cost-sharing reductions, regardless of whether you are already enrolled in a qualified health plan, you qualify for an SEP. The marketplace must permit access during this SEP if your existing coverage through an eligible employer-sponsored plan will no longer be affordable or provide minimum value the upcoming plan year prior to the end of your eligible employer-sponsored plan. You also qualify for an SEP if you gain access to new qualified health plans because you permanently moved to a new area, or if you demonstrate to the marketplace, in accordance with guidelines issued by HHS, that you meet other exceptional circumstances as the marketplace may provide. The final special enrollment period we will talk about is for members of federally recognized Indian tribes. The healthcare law includes the permanent reauthorization of the Indian Healthcare Improvement Act, which extends current law and authorizes new programs and services within the Indian Health Service. It provides unique provisions for Indians, including special enrollment periods. An Indian, as defined by Section 4 of the Indian Healthcare Improvement Act, may enroll in a qualified health plan or change from one plan to another one time per month. This means they have a continuous special enrollment period. Now that we've covered who is eligible and when you can enroll, let's talk about how to apply for and purchase a qualified health plan through the marketplace. The enrollment process will be done through a single streamlined application that allows you to see qualified health plan choices, compare their costs and quality, and determine whether you are eligible for the new premium tax credits, cost-sharing reductions, Medicaid, and/or the Children's Health Insurance Program at time of enrollment. States may use another type of application if approved by the Secretary of HHS. Applications may be submitted online, by phone, by mail, and in person. Because the application process has been streamlined, you can apply and find out if you and/or members of your family qualify for coverage and affordability programs from the marketplace. This slide illustrates 3 different outcomes to the same application for different qualified individuals. Ben applied and qualified to buy coverage from the marketplace. Alice applied and found out she qualified for Medicaid for herself and her daughter. James applied and qualified to buy coverage from the marketplace. He also qualified for the new tax credit that lowers his monthly premium right away. So as you can see, the application simplifies the process. They all used the same application but got different results based on their qualifications.
It's time to test your knowledge again. Which of these answers is correct? The initial open enrollment period is from A. October 1, 2013 to March 31, 2014, B. October 7, 2013 to December 15, 2013, C. October 1, 2013 to January 31, 2014, or D. October 7, 2013 to December 31, 2013. The answer is A. The initial open enrollment period for the marketplace is from October 1, 2013 to March 31, 2014. Choose the correct answer. Applications can be submitted A. in person or online, B. in person, online, or by phone, C. by phone or in person, Or D, online, by phone, by mail, or in person? The answer is D. You can apply online, by phone, by mail, or in person.
The marketplace provides financial help for some people with limited incomes. Let's take a look at how you may be able to save money. Let's begin with who is eligible for the new premium tax credits. With most tax credits, you have to wait until you file your taxes to get the credit. But the new premium tax credit available through the marketplace lets you reduce your costs right away. People who qualify can take the tax credit in the form of advance payments to lower their monthly health plan premiums starting in 2014, which can help make insurance more affordable. The premium tax credit is generally available to individuals and families with incomes between 100% and 400% of the federal poverty level. In 2013, 100% of the federal poverty level for a family of four is $23,550. 400% of the federal poverty level for a family of four is $94,200. This means that if a family of four makes between $23,550 and $94,200 and they don't have access to certain other types of minimum essential coverage, they may qualify for the new premium tax credit, which will make coverage much more affordable for them. The Congressional Budget Office estimates that when the Affordable Care Act is fully phased in, the premium tax credit will help 20 million Americans afford health insurance. The new premium tax credit will be applied when you sign up for qualified health plan coverage through the marketplace, and the payment will go directly to the insurance company. When you apply, you will provide your household income, identification to show that you are in the U.S. legally, and other information. The marketplace will determine what benefits you're eligible to receive. You will buy the plan, and the tax credit will be applied at that time to lower your cost. You will save more money if you choose a less expensive plan. The age-based increases in premiums are included when the premium tax credit is calculated, and the advance payment of premium tax credits is reconciled at the end of the tax year. Another affordability program is cost-sharing reductions. These are available to help people afford the insurance coverage they buy through the marketplace. To be eligible for cost-sharing reductions, you must have a household income that is less than or equal to 250% of the federal poverty level, which is $58,875 annually for a family of four in 2013. You must also meet the requirements to enroll in a health plan through the marketplace, receive the new tax credit, and enroll in a silver level plan through the marketplace. A member of a federally recognized Indian tribe may also be eligible for special cost-sharing rules. Certain American Indians and Alaska Natives who purchase health insurance through the marketplace do not have to pay copays or other cost sharing if their income is under 300% of the federal poverty level in 2013, which is roughly $70,650 for a family of four. That would be $88,320 in Alaska. The marketplace will have a special kind of plan called a catastrophic plan. This will provide affordable individual coverage options for young adults who are under 30 years of age and certain people for whom coverage would otherwise be unaffordable. These plans will have high deductibles and lower premiums. They will cover 3 primary care visits. They will also cover preventive services with no out-of-pocket costs. This will protect against high out-of-pocket costs.
Let's test your knowledge. Complete the sentence. The blank determines who qualifies for the premium tax credit at the time of enrollment. A. Homeland Security. B. Marketplace. C. Social Security Administration. Or D. Centers for Medicare and Medicaid Services. The answer is B. The marketplace will determine who qualifies for the new tax credit at the time of enrollment. Choose the correct answer. The new tax credits will A. help reduce your co-payments. B, help reduce your monthly premium. C, help reduce your deductible. Or D, are not available until tax time. The answer is B. The new tax credits help reduce your monthly premium right away.
In this session, we will talk about Medicaid and the Children's Health Insurance Program, also known as CHIP. Medicaid is a joint federal and state program that helps with medical costs for some people with limited income and resources. Medicaid programs vary from state to state. The Children's Health Insurance Program, which is also called CHIP, is a joint federal and state program that provides free or low-cost health coverage for children up to age 19. The healthcare law simplifies the eligibility process. When you apply, there is no wrong door. Instead, it establishes a seamless system of health insurance coverage across the marketplace, Medicaid, and the Children's Health Insurance Program. Medicaid and CHIP will serve as the foundation for this new system, providing coverage for low-income adults and children, with the marketplace serving individuals with slightly higher incomes. The new eligibility rules for all three programs will be aligned and easier to understand for families, and everyone will have an opportunity to enroll in coverage using a single unified application. A new website is also available for program information with the option to enroll. The healthcare law fills in current gaps in coverage for the poorest Americans by creating a minimum Medicaid income eligibility level across the country. Beginning in January 2014, individuals under 65 years of age with incomes up to 133% of the federal poverty level, or FPL, may be eligible for Medicaid in those states that proceed with the Medicaid expansion. In addition, all children with incomes up to 133% of the FPL will be eligible for Medicaid. Those states that previously covered these children through the CHIP program will continue to receive the enhanced CHIP matching rate. In addition, the rules for counting income for the purpose of determining Medicaid and CHIP eligibility will be much simpler and easier for families to understand. Now, income will be calculated using Modified Adjusted Gross Income, or MAGI. The new rule simplifies Medicaid and CHIP eligibility, enrollment, and renewal process in the following ways. Eligibility verification procedures are modernized to rely primarily on electronic data sources, while providing states the flexibility to determine the usefulness of available data before requesting additional information from applicants, and simplifying verification procedures for states through the operation of a federal data services hub that will link states with federal data sources such as Social Security and Homeland Security. Also, current Medicaid policy is codified so that eligibility is renewed by first evaluating the information available through existing data sources. It limits renewals for the people enrolled through the simplified income-based rules to once every 12 months unless the individual reports a change or the agency has information to prompt a reassessment of eligibility.
Let's test your knowledge. Choose the correct answer. The shift to a simplified way of calculating income to determine Medicaid and CHIP eligibility is known as A. Modified Adjusted Gross Income, MAGI, B. Medicare, C. Advanced Premium Tax Credit, or D. Modified Annual Gross Income, MAGI. The answer is A. The shift to a simplified way of calculating income to determine Medicaid and CHIP eligibility is known as Modified Adjusted Gross Income, MAGI. Choose the right answer. All children with family income up to blank % of the federal poverty level will be eligible for Medicaid. A. 400%, B. 250%, C. 100%, D. 133%. The answer is D. All children with a family income up to 133% of the federal poverty level will be eligible for Medicaid.
The marketplace will provide a number of resources to help consumers find and compare plans. Let's talk about the assistance that will be available. If you have questions or need help applying, there are several resources that will be available, including a toll-free call center which can help you walk through your options. There will be a website with plan comparison tools that will include plan costs. There are also several programs to help you through the process of finding and using health insurance, including the Navigator program, in-person assisters, and enrollment counselors. Community-based organizations, agents and brokers, and other third-party assisters will also play a large role in helping people apply for health insurance coverage. The final rule lays out ways for agents and brokers to help consumers and small businesses enroll through the marketplace if the state so chooses. It is important to note that some of the assistance resources, like the marketplace call centers, websites, and the navigators, will provide unbiased and impartial information. However, others, like agents, brokers, and issuer websites and call centers, will not. For information about enrolling in Medicaid or the Children's Health Insurance Program, check with your state medical assistance office. Visit www.medicare.gov/contacts and search for your state Medicaid office's contact information. The marketplace is going to have a Navigator program. The federal government will provide grants. Navigators will help raise public awareness about the marketplace, reach out to diverse populations, help consumers understand their coverage options, and provide referrals. They will provide culturally and linguistically appropriate information. The marketplace must develop conflict of interest standards and training programs to ensure that navigators provide unbiased and accurate information. Navigators can't receive payment from health insurance issuers for enrolling consumers, employers, or employees in qualified health plans or in non-qualified health plans outside of the marketplace. However, they can help consumers with other non-navigator-assisted enrollment functions. Agents and brokers may serve as navigators if the state so chooses, as long as all other navigator standards are met. But they can't be paid by an issuer for enrolling people in their plans. Agents and brokers can help employers find, choose, and enroll in coverage. They will be able to receive compensation from the health insurance issuer related to enrollment. Navigators will help consumers and small employers find and compare qualified health plans available in the marketplace, but they won't actually enroll people. But it's important to note that navigators can't receive compensation from health insurance issuers related to enrollment. This helps ensure they are providing unbiased assistance.
Let's test your knowledge. Each marketplace will have a call center and website. Choose A for true and B for false. The answer is A, true. Each marketplace will have a call center and a website. Which of the following will navigators not do? A. Raise awareness about the marketplace. B. Provide unbiased information about enrollment. C. Be paid by issuers to enroll people in their plans. Or D. Give referrals. The answer is C. Navigators will not be paid by issuers to enroll people in their plans.
Now that we have walked through information about the marketplace, let's look at this high-level list of some key points for you to remember. The marketplace is a new way to find and buy health insurance. Individuals and small businesses can shop for health insurance that fits their budget. States have flexibility to establish their own marketplace. There is financial help for working families and other people with limited income. There is assistance available to help you get the best coverage for your needs. You have choices. Employer-based coverage will continue, and insurance will continue to be sold outside of the marketplace. The marketplace will be the only way to access the new premium tax credit and cost-sharing reductions to help you with healthcare costs. There are resources currently available for you to get information on the healthcare law, the marketplace, Medicaid, and the Children's Health Insurance Program. Information is available now on www.healthcare.gov. This is the official government website for information on the healthcare law. Use this website to help you identify both private and public health coverage options available in your area. You can sign up to get email or text alerts so that you can stay up to date. Read through it to learn what you can do now to get ready for Marketplace enrollment in October 2013. If you visit marketplace.cms.gov, you can find consumer materials like publications. You can also access training materials, multimedia products, research, and materials in Spanish and some additional languages. This information can help you learn more and can help you inform others who may need help understanding the marketplace. Visit www.medicaid.gov for more information about Medicaid and the Children's Health Insurance Program.